welcome to Flourish Flow. I'm your host, Amy Rohrer, owner and yoga teacher here at the Yoga Hut in Tillsonburg, and we are here talking today on the show, helping people connect the dots to true wellness on their own journeys. If my own wellness journey has taught me anything, it's that there is no one-size-fits-all approach to flourishing and really finding our own unique paths. On today's episode, we are joined by co-founder and managing partner of Restorative Health, Inc. here in Tillsonburg, Stephanie Nevins. Stephanie is an outgoing, approachable individual with over 15 years experience working in human resources, and she also now serves in the Ingersoll Nurse Practitioner-Led Clinic as the executive director and enjoys participating in initiatives to support a healthy Oxford County and giving back to the community. Outside of work, she enjoys spending time with her family and cheering on her children at their many activities, I'm sure. Busy voice. So welcome to the show, Stephanie.
Thank you. Thanks for having me.
Yeah, really happy to have you here. You have quite the inspiring journey that's led you to starting your wellness center, Restorative Health, Inc. I love getting to hear people's stories of what led them to these unique paths and starting their businesses or what they're doing in Oxford County. So could you tell our viewers kind of that inspiring journey that led you to kind of see that gap that needed to be filled here in Tillsonburg?
Absolutely. So I worked actually in Tillsonburg for many years in the HR field. And, after 10 years or so, I was interested in seeking a bit of a different job. And that's how I landed my position as the executive director at the Ingersoll Nurse Practitioner-Led Clinic. I continue to do HR type work there, but it's very operational. And after serving there a couple of years, since 2017, I just really got a firsthand pulse on what we have available in the community and also what we don't have available in the community for patients. So from a primary care perspective, and just in talking to my colleagues, we noticed there was a gap in Tillsonburg specifically for pelvic floor physiotherapy and different treatments that were available for women and men as well. And I just decided we need to bring this to town. And so that was kind of the evolution of Restorative Health.
Yeah, okay. So tell us a little bit more about, we won't go into all the details, but what do you offer there?
For sure. So we have 2 pelvic floor physiotherapists. They also do musculoskeletal physiotherapy as well. And then 2 registered massage therapists that work with us. We've got 2 nurse practitioners that come in and consult if needed. And then a couple of nurses as well that do clinical injections. So one of our treatments that works in an adjunct to pelvic floor physiotherapy is our Plus 90 treatment. Which specifically treats women who have urinary incontinence issues or other vaginal issues that tend to impact us quite heavily in the pelvic health world.
Yeah. So if somebody, where would they start? If they called you up or they went into Restorative Health, how would you assess kind of what would be the best fit for them?
Yeah, absolutely. So I'll generally have a conversation with patients who call and talk to them a little bit about some of their concerns. If they've recently had an appointment with their primary care provider and they have a good understanding of some of the pelvic health concerns they may have, or any other concerns they may experience, then we are generally quite quickly able to navigate which provider that is most appropriate for them to see. If they have not, but they're expressing they have pelvic concerns or low back, hip concerns, things like that, we'll have them do an assessment with one of our physiotherapists. And from there, a treatment plan is generally provided for them. It's often, a partnership between the therapist and the patient to get them doing some of the things that they may need to do to restore their health.
Okay, great. And you also, on the other side, you said that you have been working at the Nurse Practitioner Clinic in Ingersoll, which is amazing. I didn't know about that until recently, but tell us a little bit about that clinic, because I think that's a great resource that maybe not everyone knows about in Oxford County.
So the Ingersoll Nurse Practitioner-Led Clinic is one of 25 clinics across the province of Ontario. It's fully funded by the Ministry of Health and Ontario Health now. All of the providers there are compensated via salary, so it's an organization that does not bill OHIP. For viewers that may not know, nurse practitioners can practice in primary care as the most responsible provider for a patient, which is very similar to a physician, but they're not able to bill for their services. So in order for them to be employed and work in primary care, they need to be employed by either an organization that's funded by the ministry or by a physician's office. Their salary would need to be compensated by that family health organization or things like that. And it's an interdisciplinary team. So we have nurse practitioners, administration, we have registered practical nurses and social workers there. So we serve 3,200 patients, providing them the full scope of primary care from birth to death to end of life. And all of our patients have access to our entire team. So it's talked about a little bit more now about the healthcare system and how patients, you know, they don't always need their physician or their nurse practitioner, but they may need a member of their team. So for mental health and addiction, for example, the most appropriate person to see a patient may be a social worker, or for chronic disease care, like care for diabetes or foot care, it might be a registered practical nurse. So all of our patients have access to the entire team, and it's a really incredible model.
That's amazing. Yeah. And how long has it been in Ingersoll?
So we've been there now since 2010.
Okay,
So,
wow.
Yeah, just over 10 years.
And I've just learned about it.
Yeah.
But that's, you know, that's the thing about getting the word out on
Absolutely.
these initiatives and things in our community. So we are going to chat more about all the things that you do at Restorative Health and like what pelvic floor physio really is after this short break. So stay tuned. Welcome back to Flourish and Flow. I'm joined today by Stephanie Nevins, and she's kind of wearing a hat of wellness in the Oxford County community, owner of Restorative Health, and then you also work at the Nurse Practitioner-Led Clinic in Ingersoll. But I want to focus a little bit more on Restorative Health. And you saw this need for kind of pelvic floor physio, some of those services that were not readily available in Tillsonburg. For those who might not know what pelvic floor physio is, because I really didn't until becoming pregnant. That was when it first kind of came to my attention of, you know, how to prepare and recover the pelvic floor. But it's also, I've learned that it's not just, you know, for pregnant people, it's not just for women. There's lots of people who might be able to receive a lot of benefits from that service.
For sure.
Yeah, so what is it?
Yeah, so our physiotherapists at the clinic provide both musculoskeletal and pelvic floor physiotherapy.
Okay,
so
great.
it's a great combination of treatments to be able to offer to patients, because often we present with back pain, low back pain, hip pain, things like that. And the first thing that comes to mind is I must need a massage. I must have pulled my back, or I must need musculoskeletal physio on my back.
Yeah.
But the reality is the pelvic floor really supports the body in so many different ways. There are tons of muscles only accessible on the interior of our body, as well as many that are accessible on the exterior.
Yeah.
So our pelvic floor physiotherapists will generally assess patients. They can treat patients for a variety of things. So often with women, we find with women who maybe have not had any children, but are very, very active. So physically active, working out, doing all the burpees, they may experience things like urinary incontinence, pressure of the pelvic floor. And those individuals, we've often been told over the years, do your Kegels, you must need to do your Kegels. There's so many women actually who have an overactive pelvic floor. So they're actually experiencing tightness in their muscles that needs to be relieved. So Kegels is not the answer.
No. Yeah.
Even though that's what we've been taught. And then on the flip side of that, there are many women, most often women who have experienced childbirth or any sort of we'll call trauma to the vaginal canal or to the pelvic floor, that may have an underactive pelvic floor. So their muscles may need strengthening or tightening, and the pelvic floor physiotherapist can treat that. And it's often a variety of things. Pelvic floor pain actually often presents in the hip. So when someone presents with that, we're always going to look that, do they need pelvic floor physio or just regular physio? And maybe the answer is massage. Maybe it is muscle as well.
Yeah, but it's finding, instead of just trying all these other routes, like finding really what the source that needs support is.
That's right.
And they can do that exam that can help determine which is the best course of action, right?
Exactly.
Yeah, and then what are some of the other unique offerings that maybe you want to give a little bit more education
For
about.
sure, yeah. So we also offer a treatment called Plus 90. It's performed by a Canada-approved workstation, and it uses volumetric heat and radio frequency. It's an internal and external treatment that treats skin laxity and also helps tighten the pelvic floor.
Okay.
So for individuals, as long as they're not pregnant, or individuals who are finding that their manual treatment is taking a lot longer than they hope, they can utilize this treatment to get them some significant gains, either in the interim or possibly as a solution as well. And then we also have another treatment called Morpheus 8. So this is outside of pelvic physiotherapy or pelvic treatments, but it is a microneedling radio frequency treatment. So it can be used anywhere on the body. It treats and often resolves cystic acne. It can be active cystic acne. Individuals who have scarring on the body, whether it's accidental or, we'll call it scheduled scarring due to surgery or something like that, it can treat those areas to diminish the scars.
Okay, wonderful. So some unique services that people might not have heard about before.
Right.
And what is maybe one of the biggest misconceptions that you hear as far as whether or not these services are for people, like pelvic floor physio, for example, I'm just curious to hear what some of those misconceptions might be.
One of the biggest things that we often hear from patients when they come into the clinic is they'll say, well, I've heard about this, but, I've been peeing my pants for years and I've just been told it's normal. Like, this is the course of aging. This is the course of being a woman or an individual who's giving birth to children. And, we appreciate that because it's a lot now about learning opportunities, having conversations that historically people have been uncomfortable having. So often having those conversations are, kind of the biggest. It's not news to us anymore, but even for myself, when I first learned about pelvic floor physiotherapy and about the Plus 90 treatment, I just always thought, like, peeing your pants when you jump on a trampoline is normal after you have kids, or, aging women who are experiencing menopause, vaginal dryness, no treatment for that. Like, you just have to live with that. And that's actually not true.
Yeah, it's great that these conversations can be had and kind of breaking some of those things that people live with that are maybe common, but not normal or not ideal, that there is like actually a solution. Yeah. So I'm curious as well how people can get in touch and what is the best course of action to reach out to Restorative Health or book an appointment.
Yeah, so you can call the clinic at any time, 226-970-3741. The phones may not be answered right away. Often all of our practitioners are seeing patients, so leave a message, we can get back to you for sure. And leave any detailed questions that you may have on the voicemail as well. We have email, you can contact us via email, info@restorativehealthinc.com. We have a contact page on our website, so you can visit our website as well. And there's online booking. So if you're more comfortable with that, being able to look at your own calendar and the calendar online as well, then you can go ahead and book an appointment that way as well.
And what is the website again?
It's www.restorativehealthinc.com.
Okay, good. Restorativhealthinc.com. And then also any information on the Nurse Practitioner Clinic. How can people learn more about that?
Yeah, absolutely. So there's lots of information available online. So if you're looking for information about how the ministry funds the clinic or Ontario Health funds the clinic, you can find that information on Ontario Health websites. Information specifically about our clinic, you can just type in Ingersoll Nurse or IngersollNPLC.ca, and it'll bring you to our website. And you can also, I believe, see, if you look on the NPAO website, it lists all of the nurse practitioner-led clinics across the province.
Yeah, that's amazing that there are other ones. Like I learned a lot through talking to you about just how that initiative started, and they're kind of in these smaller communities where they saw a need.
That's right. Yeah. When they decided to implement the nurse practitioner-led clinic model, it was identifying a need across the province where often rural communities or there was like specific community population need. So for example, some of the clinics are in the north where there's no access to physicians without a couple-hour drive. Some clinics are located in communities like ours where, just a shortage of certain providers often because we have smaller hospitals in our community. And then other clinics were placed in specific areas where there may be a lack of care available for women and children, or it might be low income communities, things like that.
Yeah, that's great. We're lucky to have that here in Oxford County. I'm curious with these, kind of two areas that you're working in, like what's your favorite part of the work that you do?
I've grown up in Tillsonburg my whole life, and so to be able to be involved in this work, in particular from an advocacy perspective, I get to work so closely. It's a privilege really to work with Ontario Health and talk about Oxford and talk about the small communities within Oxford and our individual needs, and just be able to continue to advocate for more resources to the community. It's a huge passion of mine, and my kids are here, and so I want them to be able to have access to all the things that we either have now or more.
Yeah. Do you find, were you always passionate about health, or has that kind of come through working at the clinic and seeing more of the gaps?
Yeah. So I always, in my previous role working in HR, I definitely had a passion for people. So, helping them find employment. It was really important to me. I loved being able to be a part of somebody's journey to, seek employment. And as I navigated myself towards the healthcare sector, making sure that there's services available, it's my new way of being able to help people and connect people and touch people. So definitely it was something that evolved for me.
Yeah, well, Oxford County is lucky to have you, and, just helping to make sure that, those services that we need are being met. So thank you for the work that you do. I'm curious, with kind of all these hats that you juggle and being a mom as well, how do you take care of yourself? What's that look like for Stephanie?
Yeah, so I have to be honest, there was a time a few years ago where I started to lack in that area, and I think experiencing the pandemic and not being able to do certain things has really grounded me and enabled me to put on those separate hats and prioritize my work and also my family a little bit more.
Yeah.
So, previously I used to play slow pitch in the community or played ringette in the winter, and this summer I'm going to play pickleball with some friends. So I try to keep engaged, but also really want to make sure that I can be around for my kids.
Yeah, so kind of finding something that you're passionate about and taking that time for yourself.
Exactly.
Have you played pickleball before?
I have.
Okay, it's fun. Yeah, and it's really up and coming in Tillsonburg too.
Yeah, it's thriving in the area. So
I used to work for an organization that we had to set up and kind of not referee, but just facilitate, and it would get very competitive and
pretty intense.
Yeah. So good luck with your pickleball endeavors. We are going to go to a short commercial break, but we will be back with Stephanie very soon. Welcome back to Flourish and Flow. I'm joined today by Stephanie Nevins. She is co-founder of Restorative Health Inc. and also executive director at the Nurse Practitioner-Led Clinic in Ingersoll. But in addition to that, you also you're really active in the community. So I'm just going to mention a few of these things that Stephanie does. She's a board member of the Tillsonburg District Chamber of Commerce. So you've probably seen her at some different events in Tillsonburg if you are involved in the business community. She is a member of the Ontario Chamber Health Policy Council and also the current board chair of Alexandra Hospital Board of Directors. So that I'm curious, how do you do all that? But also, why are you so passionate about really using your skills in that way of giving back to the community?
Yeah, thank you. So one of the first community resources that I was ever connected with was the Tillsonburg District Chamber of Commerce. I got to work with them, and it was a way that I got to learn about so many different businesses in the community, and just building those partnerships and having those individuals to be able to call on, when you've got successes or challenges in business. It was so valuable. I'm actually not a director anymore, so my term has expired on the chamber board, but I do still sit on their advocacy committee. So when there are policies that are being presented across the province, so things that are important, so one specifically that we wrote recently is about ensuring that there's access to team-based care in rural communities. And that really coincides with the work that I do now, both at Restorative Health and at the Ingersoll NPLC, really wanting to expand those models and being able to leverage the tools that are available to people. So having the chamber locally, but also provincially to support you is amazing. And getting that message to government and, you know, if there's any, there are a lot of legislative barriers actually to whether it's to conduct healthcare or provide services in healthcare or just in business in general. You know, it could be the roads. There's so many things that we do rely on these resources to be able to get action taken. So
we're really lucky. I mean, Tillsonburg has a very active, thriving Chamber of Commerce. So it's great to like that we have access to that, but also that you are, you know, spearheading kind of these initiatives in the wellness realm too. And then what about what led you to the board of directors at the hospital?
Yeah, so I started working closely with the hospitals. In my role at the clinic, we work very closely with all the primary care providers in the community, as well as other resources that may relate to healthcare in the community. And then of course the hospitals. So our hospitals see our patients, you know, often, whether it's for orthopedic surgery or, you know, a last minute emergency visit in the middle of the night. And so getting to know the hospital better became, you know, something that was really important to me, and how the hospital functions, just being able to understand that. And then they had a seat available on their board, so I applied for that and just thought like this would be really great for me personally to better understand the hospital. And also for the clinic to have a really good partnership with the hospital. Often, even working in healthcare, there's many things that we don't know because the system is so big. So understanding better how to navigate that was really important. So that was originally why I expressed some interest in that role there. And they're currently looking for individuals for the board of directors. It's a joint board of directors. So Tillsonburg and Ingersoll, they work very closely together. And looking for board of directors right now.
All right, there you go, folks, if you're interested. If that is not somebody's route, but you know, I'm sure that somebody watching might be, but if there's another way that people can get involved, like you're very connected in our Oxford County, so what would be your advice for someone who wants to get more involved? We actually have a lot of newcomers to Tillsonburg, people moving from other areas who, you know, want to get involved, but maybe don't know where to start.
Absolutely.
What would you say?
So I would say definitely contacting the Chamber of Commerce is a great place to start. Or the local BIA, the Business Improvement Association. They often know about, you know, different ways people can support an organization or different organizations that are looking for individuals to dedicate their time to them. If you're not interested in business or the hospital or health, you know, all of our amazing recreational organizations in the community, like Tillsonburg Minor Hockey or the soccer club, you know, they're always looking for individuals that can help support the organization and offer more resources and activities to the community as well. So
those are
any of those, or they can contact me.
There you go. Just shoot her a message.
I don't know it all, but
and I think it comes down to as well, like just kind of thinking about what are your likes and passions, and like there's a way to maybe connect that into the community somehow. And you've done a phenomenal job of using your skills to, you know, help foster a healthier Oxford County. So thank you for all that you're doing. Okay, I want to make sure we have time for the lightning round, just some fun pop questions for people to get to know you better. And Stephanie does not know what questions are coming, but just like first thing that comes to your mind. The top thing on your bucket list.
I would like to go to Europe, to Hungary and Romania to see where my dad was born.
Oh, that would be amazing. Yes. Favorite way to fill your own cup as you juggle, you know, your work and motherhood? What's your favorite, like, self-care activity?
My family and I actually, we enjoy ATVing. And so I find that being able to do that with them and like just being outdoors is, we head out and then you just feel like so, I don't know, so much joy afterwards.
Yeah, being outside for sure. Your biggest pet peeve? Let's hear it.
My biggest pet peeve, when people text you back K, the letter K.
The short answers. I agree with that one. Favorite place you've ever traveled?
That's a tough one. I've actually not done a lot of traveling over the years, and it's something that I've decided in the last 6 months to make a priority. So traveling with my family and traveling with my husband. My husband and I are going to Punta Cana in May to celebrate our 10-year wedding anniversary.
Oh, congratulations.
And thank you. And then we're planning a trip to Jamaica with the kids as well in the fall. So
okay,
I'm looking forward to those.
Well, thank you so much, Stephanie. It was fun to get to learn a little bit more about you that way. And again, just quickly, how can people get in touch with Restorative Health, your website?
Yeah, so you can call us at 226-970-3741. You can email us at info@restorativehealthinc.com, or you can check us out on our website at www.rfrestorativehealthinc.com.
Wonderful. Well, thank you again for coming onto the show and sharing your wellness wisdom. On behalf of everyone here at Rogers, may you continue to flourish and find your flow.